someone like yourself, John, do you find manual therapy useful?
Of course.
Yeah.
And I think the biggest thing, we always have this discussion. If anyone ever dispels the utilization of manual therapy as being valuable, they clearly have never worked, say, in sport, and particularly in elite sport. Like, if you get someone come off the ground, off the pitch, and it's it's a final, it's a grand final, whatever it is, and they say, oh, my calf's a bit tight, and you can't do anything at that moment to change their perception of discomfort or tightness or tone or whatever they feel, then you're effectively useless at that point. You're not going to say to them, oh yeah, like during the week, we'll start doing some calf, strength work. We'll start doing some exercise interventions.
Yep.
You want to be able to create physical change. Now, there are certain things that they may do themselves. They actually might do a series of different stretches or exercises that may actually make their calf feel better, right? But you also do have the ability to place your hands on someone and create some of that change. And I think that the thing that seems to confuse people is, what effect different manual techniques have. And I thought it was important that we discuss that because I know that you've been sort of looking more and more into the evidence around this.
Well, and look, that's a better question to phrase is what does manual therapy do and in what context is it going to be useful? Because we need to essentially apply the same principle we use with exercise. When we think about exercise, we think about that there's lots of different types and we can determine when we use different types and how we actually configure different variables in terms of like intensity, duration to elicit a certain effect. We have to be the exact same in terms of how we think about manual therapy and applying it. So I think first thing we need to think about is what does manual therapy do at a neurophysiological level? And
what does it do at a neurophysiological level?
Well,
because the thing is, people would argue it doesn't really do anything.
Well, and that's just where you're wrong. But one thing that is clear is if you look at some of the underlying mechanisms are quite well understood, and we understand that depending on the type of manual therapy you use, and in particular the intensity, you will elicit different effects. So this is where I think sometimes you can become undone, where if you're using manual therapy purely as a modality to induce mechanotransduction, it's not going to create a really large magnitude of force to create specific structural changes to the tissue.
Yeah, and it's not going to be those chronic changes that you would see, say, with the long-term application of exercise.
Absolutely.
And these are some of the things that, you see with the studies that are coming out now, looking at changes in, say, tissue architecture associated with types of contraction, particularly if it's done over a period of time.
Yes.
You're potentially not going to see that with something like manual therapy. However, you may be able to start changing the way in which they can undertake that intervention in the first place. Because the one big thing, and we've been talking about this a little bit in preparation for this, is that manual therapy has a huge effect on pain perception.